I will just briefly give some information about the presence of Crimean Congo hemorrhagic fever in Kosovo. Some background information. Crimean Congo hemorrhagic fever is a zoonotic viral disease. It is very asymptomatic in infected animals, but a serious threat to humans. Human infections begin with febrile symptoms, progress to very serious hemorrhagic syndrome with a quite high case fatality rate. Disease is a threat to farmers, agriculture workers, veterinarians, laboratory workers, and hospital personnel. But this doesn't mean that everybody and each of us, we are at high risk of getting disease if we are in contact with the transmitters of infections. Disease is caused by a virus with the same name, Crimean Congo hemorrhagic fever virus. Disease and virus, it is spread in a different geographical region. So there are some few differences between strains of Crimean Congo hemorrhagic fever in different geographic regions. Main route of transmission of the infections are female ticks, Hyaloma species, and that in nodule and adult form. This is a male tick who doesn't transmit infection at all. What is important here to mention that the tick, one get infected, stays infected for whole life, and also transmits the disease, the virus to their eggs. Another mode of transmission is animal to human, and it is one of the rare zoonotic disease when human to human transmission it is present. This is, these three ticks are Kosovo ticks. It is from first place. Geographical distribution is the disease is present in countries at 50 degrees below of the equator. It is quite spread disease in African countries, Middle East, in some part of Europe, including Kosovo. The presence and occurrence of the disease is in correlation with the distribution of the ticks Hyaloma species. Recently, climate change became an issue, so also we are asking ourselves about the affection of climate change on increasing the density of the ticks and also their expansion of the ticks to the country above 50 degrees of Ecuador. So coming years, we are expecting that the countries who didn't have Crimean Congo hemorrhagic fever so far, they will have it. What about Kosovo? Kosovo, it is located in southwest Balkan Peninsula. It is affected by a climate, humid and continental one, but also it is influenced under Mediterranean and oceanic ones. All the country, it is surrounded by the mountain, but what is important here to mention that 52% of the land, it is identified as or classified as agriculture 1. First cases of CCHF in Kosovo, they were officially registered back to 1954 in one family, in one house with 8 deaths. From 1954 till 1989, no disease were appeared or officially were reported. So in 1989, it was another family affected with 4 infected cases and 2 deaths. Back in 1995, it was registered one of the massive outbreak of Crimean Congo hemorrhagic fever with 46 confirmed, lab-confirmed cases that they were dispersed in 46 different settlements in Kosovo. From 1995 till now, cases appeared every year in sporadic or an endemic form. I will just provide some brief information about the incidence of disease, case fatality rate, geographic distribution of cases, geographical distribution of ticks, and also two types of viruses that they are present or isolated in Kosovo. The data that I'm going to present, they are taken from Archive of National Institute of Public Health of Kosovo. In the period of 19 years, they were registered 239 cases that all these cases are laboratory confirmed cases with an average of incidence rate of 0.66 cases in 100,000 inhabitants, where large or highest number of the incidence is during the outbreaks. Average case fatality rate, it is 25.6%. It is quite high, but if we compare with case fatality rate with other countries, it is almost the same. Case fatality rate is high not only during the outbreak, but also in between two outbreaks. As I mentioned, in regards of group age distribution, all ages are affected, but mainly are affected the group age above 15 years old due to their daily life activities. Mainly mode of transmission, as I mentioned earlier, and in Kosovo also, they are tick bites, but unfortunately, in Kosovo, we had cases of human-to-human transmission and also vertical transmission in 2013 from mother to newborn. In terms of geographical distribution, cases are located in a central part of Kosovo, mainly in 4 municipalities, and this municipality here, Mališevo, last couple of years, we are calling as a center of world for Crimean Congo hemorrhagic fever. Location or geographical distribution of cases are very much linked with the distribution of hyalom of ticks, Hyaloma marginatum, that they are mainly present and with high density in a central part of Kosovo in this region. If we go back to previous slide, we also can see that these 4 municipalities, they are with dark red, but also other municipalities, they are red, but they have light reds due to the fact of the presence of 7 different types of ticks in Kosovo, and they are distributed all around the country. But now our main concern and the focus is on ticks, Hyaloma marginatum species, that they are mainly present in endemic zone, and they are carriers of virus of Crimean Congo hemorrhagic fever, and they cause very severe clinical picture. But what happened recently in Kosovo, we found that even in non-endemic zone, not that we have other ticks, but also it is Rhipicephalus bursa species, that they are carriers of Crimean Congo hemorrhagic fever, and also they are carriers of prototype virus AP92 that they cause mild clinical feature. This is now became a concern because of presence of Crimean Congo hemorrhagic virus in different type of deer or different species of the ticks. In this regard, because also the serosurvey done to know better the seroprevalence in Kosovo. So in overall seroprevalence in Kosovo, it is quite high, 4%, but the main or the highest seroprevalence, it is in at municipalities or in the region which is detected or identified as endemic zone for Crimean Congo hemorrhagic fever. Just to conclude that for Crimean Congo hemorrhagic fever, as for other vectors, as Hedia mentioned, climate, environmental, and anthropogenic factors have driven the expansion of Crimean Congo hemorrhagic fever endemic foci, not only in Kosovo, but in other countries as well. Kosovo is an endemic zone with high incidence and a case fatality rate. Hotspots or geographic distribution are in correlation with the distribution of ticks hyaloma species as a main source and reservoir of the virus. Seroprevalence is in correlation to the disease incidence. So if we want at least to keep the situation under control, we have to address our control measures in three directions: decrease population or density of the ticks, prevent contact of animal with ticks as one very important chain on development of the disease, and prevent contact of humans with ticks. Even human beings are bited by ticks suddenly. That happens just like that. Thank you. Okay, sorry. I had actually permission to present some pictures of our patients, but the clinical feature and the pictures were not very comfortable to show here. So I'm just presenting. It is a tick very deep inside the skin, which is one of, let's say, fact that this person, if the tick is infected, it is at high risk to get sick. Just to give an idea that a person with a Crimean Congo hemorrhagic fever bleeds from nose, from ear, from mouth, from feces, etc., etc. And also, it's our patient, which is in the first stage of the clinical feature. It is a light bleeding from the eyes. Thank you.
Are there any questions? Yes, please.
Thank you, Isme. Very, very nice presentation. And I have 2 or 3 questions about Crimean Congo. First, I'm interested about the human-to-human transmission. You mentioned it's 4% of your total infected cases. You mentioned this basically mother to vertical transmission. Did you reported any case from healthcare workers or family contacts?
There are 4 human-to-human transmission cases. 3 of them, they are health workers. It was an index case who transmit the infection to 2 doctors, and it was 1 assistant. And that it was in the beginning of 2000, it was 2001. It was immediately the time when we already get after tularemia outbreak and started CCHF outbreak. But situation in that time in Kosovo was like that possibility, okay, that happened, just to be short, not to talk too much. It is from index case, 2 doctors and 1 nurse. In the outbreak of 2013, we have vertical transmission. A mother was pregnant at 9 months, so she got sick from Crimean Congo hemorrhagic fever, transmitted disease to the fetus. Fetus was delivered infected and unfortunately died, but fortunately, even mother had very severe clinical feature, she survived.
And
But that
yes.
happened in 2001. So far, we don't have a nosocomial transmission of the cases.
Okay, thank you. My second question is related to the immunity. I don't know if you have information about the antibodies are lifelong lasting, or do you know by the seroprevalence studies, can you have an idea if you have immunity, develop immunity for the rest of your life once you are infected?
Okay. Yes, thank you. The research that it is done in 2003, we came to a conclusion that even 8 years after the disease is conducted, the prevalence or seroconversion is quite high, around 24%. That we think, and we are very much comfortable that it is only 1 time possibility to conduct the disease with Crimean Congo hemorrhagic fever virus. But now we have a AP92 virus, but with who gives a very light clinical feature. Yes, Mike.
A really interesting presentation, very graphic. Just the seroprevalence data. What can you estimate from the seroprevalence data in terms of the ratio of symptomatic to asymptomatic infection?
Actually, the data that we presented here, they are mainly from endemic zone, from cases, and from the first contacts. In it is another area that it was under survey that we found it quite high seroprevalence. That persons, they were, for example, bitten by 3 ticks, no symptomatic feature, but a very high seroconversion. We can not feel and be very comfortable about the situation because of the presence of the disease there, but we are assuming that coming years, maybe the herd immunity of population will be higher and help a little bit on the prevention of the disease. Yeah, thank you. Yes.
No, it was the question. The presentation. I am curious just about the 2 tick species. The Rhipicephalus, they do transmit CCHF, but they seem to be less important. Is it because they have different feeding behavior, or is it the vector capacity that's different for the virus?
Can you repeat again, please?
Why is it that you seem more interested with the Yaloma than with the Rhipicephalus?
Okay, because the main Yaloma species, they are main mode of transmission of Crimean Congo hemorrhagic fever virus. That it is very pathogenic, antigenic virus. And it is known all over the world. But recently, we found it not only in Kosovo, but also in other areas, that it is another strain of the Crimean Congo hemorrhagic fever virus, which is AP92, that infects the persons with this disease, but clinical feature is very mild, which means the pathogenicity of the virus is low, but helps on creation of development of herd immunity.
Okay, so, but do the rhipicephalus also carry the TCHA virus?
Unfortunately, yes, and that in non-endemic zones. So we have now to be very careful in other part of country. That is what I mentioned here. That is, so if a disease so far is concentrated in central part of country, because the Hyaloma species are located there, and they are main carriers of the virus. Now we found it that in other part of country that we identify them as non-endemic zone, we found it these ticks, Rhipicephalus bursa, that they are carriers not only AP92 prototype virus, but also to Crimean Congo hemorrhagic fever. So coming years, we have to expect that having cases in this part of the country.
But we don't know about the infectivity coming from these kind of ticks versus
No.
the one that comes. Okay.
No.
Okay, in the interest of time, if anybody has any other questions, you can ask her during the coffee break. Thank you, Isme.
Thank you.